The purpose of this video is to demonstrate the proper techniques for using the RX Destroyer. The RX Destroyer will come in two available sizes at St. Francis, the 1 gallon and the 2.5 gallon. The RX Destroyer is a product that helps mitigate drug diversion. Drug diversion can increase risk of harm to patients and their families. According to the National Institute on Drug Abuse, there were 91,799 drug-related overdose deaths in 2020. Fentanyl and synthetic opioids were the most common. The Code of Federal Regulations, Title 21, Chapter 2, Part 1317, Subpart C, details the method of destruction for controlled substances. All controlled substances to be destroyed by a registrant or caused to be destroyed by a registrant pursuant to Section 1317.95c shall be destroyed in compliance with applicable federal, state, tribal, and local laws and regulations, and shall be rendered non-retrievable. Where multiple controlled substances are commingled, the method of destruction shall be sufficient to render all such controlled substances non-retrievable. When the actual substances collected for destruction are unknown, but may reasonably include controlled substances, the method of destruction shall be sufficient to render non-retrievable any controlled substance likely to be present. The method of destruction shall be consistent with the purpose of rendering all controlled substances to a non-retrievable state in order to prevent diversion of any substance to illicit purpose and to protect the public health and safety. The RX Destroyer is compliant with federal regulations on proper disposal of medical waste. Non-retrievable is defined as the substance being permanently rendered to a non-usable state. All non-hazardous controlled medications and Diprivan will be safely disposed of using the RX Destroyer. All medication forms can be placed in the RX Destroyer. Examples include tablets, capsules, liquids, creams, lozenges, patches, and many more. Patches must be filled with the medication side facing out before placing it in the RX Destroyer. RX Destroyer deactivates medications in seconds. The RX Destroyer uses a fast-dissolving activated carbon liquid solution to neutralize medications through direct contact. The product is ready to use, meaning all staff need to do is open the container and start adding medication waste. Certain medications and products are not allowed to be added to the RX Destroyer. Examples include effervescent antacid or gassing medications, leaf marijuana, medications insoluble in water or oil-based medications, hardware such as syringes, needles, glasses, or bottles, and hazardous medications. The RX Destroyer has a shelf life of 5 years if the bottle remains unopened. Once the bottle is opened, the RX Destroyer has a shelf life of 1 year. Most units will replace their RX Destroyers multiple times throughout the year. However, to ensure that all RX Destroyer bottles are replaced annually, pharmacy will replace all RX Destroyers once per year. This will ensure that open bottles are not expired. Most units will have RX Destroyers mounted on the walls. With another licensed nurse, verify and document the waste in the Omnicell and in Epic. Both nurses will remain present during the medication waste in the RX Destroyer. Refer to policy NS4.01.05.00.00. Open the lid of the RX Destroyer. Ensure the lid securement device is intact if one is present. If medication is in a package, it must be removed from the package before placing in the RX Destroyer. If the medication is in a syringe, squirt the medication directly into the RX Destroyer, then dispose of the syringe in the sharps container. If the medication is in a vial, remove the medication with a syringe, then squirt the medication directly into the RX Destroyer. Dispose of the syringe in the sharps container. Load medication forms such as, but not limited to, pills, powders, creams, liquids, suppositories, and patches in the RX Destroyer. If disposing of a medication patch, apply clean gloves. Fold the patch with medication side facing out and place in the RX Destroyer, then remove gloves. This will allow the carbon solution to come in contact with the medication, neutralizing it. Do not place any sharps in the RX Destroyer. Once the medication is in the RX Destroyer, secure the cap back on. The cap should remain secure on the device anytime the RX Destroyer is not in use. At least 2 times per 24 hours, the RX Destroyer should be agitated for 10 seconds. To agitate the solution, ensure the cap is secured tightly and invert the bottle multiple times over a 10-second period. When the contents of the bottle is 2 inches from the top, it is considered full. When the bottle is full, ensure the cap is on securely. Place the RX Destroyer in a trash bag by itself. Dispose in the proper medical waste receptacle. Some units will need to double bag the RX Destroyer so the weight of the RX Destroyer does not rip the trash bag. Place the full RX Destroyer with a new one from the supply room. Once you have pulled a new RX Destroyer from your supply room, ask the secretary to order a replacement from S&D for the supply room. The RX Destroyer is considered eco-friendly and non-toxic. If a small spill occurs, please use an absorbent material like paper towel to clean the area. For larger spills, please contact Environmental Service to come clean the spill, similar to any non-hazardous spills. Information about the RX Destroyer can be located in the safety data sheets.